Ahead of January 16th mega nationwide COVID-19 vaccine rollout, Prime Minister Modi will be chairing a crucial meeting with all chief ministers over their preparedness of the COVID-19 vaccine rollout plan in just moments from now. The meeting is between the centre and the states in a bid to check vaccination coordination network that's been established to roll out this mammoth exercise and, of course, to ensure efficient delivery of the vaccine. Prime Minister Modi will also discuss with the chief ministers about the COVID situation in their states and the measures taken to control the spread of this virus. In fact, the meeting comes just days after Health Minister Harshvardhan said that the government was ready to roll out vaccines for the priority groups soon. Government has already identified 3 crore frontline workers for phase 1 rollout of this vaccine.
आज भारत एक नहीं बल्कि 2 मेड इन इंडिया कोरोना वैक्सीन के साथ मानवता की सुरक्षा के लिए तैयार है। दुनिया की फार्मेसी होने के नाते दुनिया के हर जरूरतमंद तक जरूरी दवाएं पहुंचाने का काम भारत ने पहले भी किया है और आज भी कर रहा है। दुनिया आज सिर्फ भारत की वैक्सीन का इंतजार ही नहीं कर रही, बल्कि दुनिया का सबसे बड़ा वैक्सीनेशन प्रोग्राम भारत कैसे चलाता है, इस पर भी नजरें हैं।
Rahul Srivastava joining us live. Rahul, a meeting now in just moments from now between Prime Minister Modi and chief ministers of all states on the preparedness of this mammoth exercise, a vaccine rollout plan, which you said is the world's largest Herculean exercise which India is carrying out.
Nabila, it's an extremely complex exercise that the country has to prepare for. There have been instances where India has carried out very successful large vaccination exercises, inoculation exercises for years, say for example polio eradication, smallpox and others. But this one is different. This one involves lakhs of people who have already been hit by COVID and lakhs face the threat. And that is why at a time when a pandemic is rolling out in India, the vaccination exercise is perhaps to ensure that the spread can be checked and more lives can be saved. And that is why this crucial meeting. Before that, as you said, the health minister has held reviews, has visited states just to ensure that on the ground the preparedness is at a high state. And also there have been dry runs, the last one involving 33 states over 730 districts. And that is why in today's meeting, if one looks at the broad agenda, the Prime Minister's first message would be in terms of a great sense of coordination between the centre and the states. That's extremely important, that each element or each stakeholder is wonderfully connected to each other, be it the central government, the state governments, the health ministry and the various state health ministries in the country, various institutions under the state and the central government. This involves hospitals which are under the private system, the government system, institutions which are medical, private and government, and at the lower level, at the primary healthcare center levels. And for that, the Prime Minister will be talking about how to coordinate. Also, the Chief Minister is expected to voice concerns regarding the IT and portal networks. That is very critical because to ensure that there is a gap-free implementation of the vaccine, the IT portal or the IT Digital India will really be tested. Beyond that, the Prime Minister is also expected to give out an appeal to the state governments to ensure that there is proper action against rumour mongering and those who are working against the vaccination on the social media and socially otherwise. Because of any gap and any kind of sense of boycott of the vaccination might leave a large swath of the population from the protective net that the vaccination is expected to create. Also the logistics in terms how and when the vaccination will reach, how it will be distributed to the lower levels. All these elements are going to get talked about in this meeting.
Rahul,
the Prime Minister's letters will be given at 4:30 in the afternoon.
If you could shed some light on this development that's come about on Chhattisgarh saying that they are not going to come up with the vaccine. They will not give out the Covaxin to its people.
You see, there are certain apprehensions as far as the states are concerned regarding the efficacy, the second line of defense as far as the Covaxin is concerned. And that's why this meeting is extremely critical. The Prime Minister is expected to make an appeal as far as the efficacy and the efficiency and the need of the vaccination is concerned. Some states are extremely wary still as far as the vaccination is concerned. And there are certain segments in the society also which needs a certain amount of hand-holding and convincing that this vaccination is important. And that's where this address, as I said earlier, at 4:30, the Prime Minister's address to the Chief Ministers is likely to go live, and viewers can see it on India Today. The government's effort would be that after the January 16 rollout, starting with the frontline health workers and others, the rollout among the common people is smooth, efficient and hassle-free.
Right.
And it's without glitches. That glitch element is something that the Prime Minister will be appealing to the Chief Ministers.
Undoubtedly, Rahul. Thank you very much for joining us with those details. In fact, the vaccination drive is going to be a mammoth exercise, like Rahul said, the biggest exercise in the country. Now, let's take you through some of the numbers here that the government is overseeing. When we speak about the vaccine, 220 per dose of the Covishield. Remember, Covishield has been approved and 220 it is priced at per dose. And now you have 57,200 crore for vaccinating 130 crore people. That's the expenditure, 57,000 odd crores for 130 crore people. And you have 7,300 crores that's already been approved by the World Bank, while 5 crore doses are ready with the Serum Institute to be rolled out. In fact, 320 crore doses will be produced, is already set and ready and to be rolled out by the Serum Institute, 50% to be exported off that. So these are the numbers more or less the government now is overseeing. Now, with the vaccine being manufactured and then leaving the production center, finally, in fact, jabs being administered to recipients, India Today's Preeti Chaudhary there explains to us this full circle and how the vaccine will be leaving the manufacturing units, going to the logistics centers, eventually reaching those beneficiaries. Let's take a listen.
The means to an end, from manufacturing to finally a vaccine shot being administered. What is going to be the entire process? How will the vaccine actually reach you? 3 phases it's divided in. So from manufacturer, the vaccine now will be transported through air towards primary vaccine stores. Now these stores are large places where the vaccine is to be stored and which are temperature controlled, which is extremely important. The 4 stores are located in Karnal, Mumbai, Chennai and Kolkata. Then in refrigerated vans, they are going to be carried through to state vaccine centers. Once again, I can't stress enough when I talk about refrigerated vans, because each vaccine has a different temperature it needs to be stored in, and one cannot meddle in that. There are about 37 state vaccine stores in this country. They store vaccines in bulk and distribute it further. From there, these refrigerated vans will take vaccines to district vaccine centers. This is how it's going to be dispersed point by point. From the district centers, the vaccines will be transported to the primary health centers. So phase 1 is about transportation. Viewers, this is going to be the biggest vaccination drive in the history of mankind, in India as well. So let's move on now to phase 2. Next, there would be a vaccine carriers where the vaccine is going to be carried to sub-center session site. It is a center, to break it down for you, where vaccinations will be finally administered. This is where, viewers, you've seen on your television screen multiple dry runs taking place. This is exactly what I'm talking about. The same place over here, registration will take place. This can happen online too, or through, most importantly, the Co-Win app. Once your name is registered, you will be allocated a specific slot. Well, the fact that you have this app is there is no need to stand in queues. And finally, you will be vaccinated. Once again, phase 2 is all about identification and issuing of shots. All right, now comes phase 3, an extremely crucial phase. In phase 3, you will get an acknowledgement, an SMS on your telephone number, the number that you've registered through the Co-Win app, and a unique health ID is going to be created. A QR code based digital certificate will be sent via the application to those who have been administered both doses of the coronavirus vaccine. Then there will be an AEFI. What does that mean? Adverse effects following immunization. Reporting, which means that if you have had an adverse reaction or an impact of the vaccine, that can and should be reported, is an inbuilt system. All this information will be available to the government and to you as well, as transparent as that. Conclusively, in phase 3, post-vaccination follow-up will also take place. This is the entire comprehensive system of the vaccination drive.
Now, in fact, the transportation of Covishield vaccine from the Serum Institute facility in Pune, Maharashtra is likely to start from today. Vaccine consignments will be airlifted to several locations across of India, and the vaccine-laden trucks will move out from Manjari location. In fact, the Maharashtra government has decided to provide police security to trucks carrying the vaccine up to the airports and to border areas of the state. As per reports, around 300 GPS-fitted trucks will be used. 500 more trucks will be roped in if needed. India will launch its Covid-19 vaccination drive from January 16th. India Today brings you this exclusive report from Serum facility in Pune. We're quickly cutting across to the meeting between the Prime Minister and the Chief Ministers of States. Here are visuals coming in, live visuals coming in of this meeting between the centre and the states on the COVID vaccine rollout and preparedness. Here's the first shot coming in. Prime Minister Modi there virtually meeting with the Chief Ministers of States. They're going to be discussing the vaccine rollout plan, a mammoth exercise which will be carried out across the country on the 16th of January. The first phase will be initiated with the first dose given to high-risk groups, priority given to, of course, healthcare and frontline workers. Here are the first shots coming in of the meeting that's just begun.
माननीय प्रधानमंत्री जी, सभी राज्यों के मुख्यमंत्री, राज्यपाल महोदय, राज्यपाल महोदय, सभी का आज की इस महत्वपूर्ण वीडियो कॉन्फ्रेंस में मैं स्वागत करता हूं। आज की वीडियो कॉन्फ्रेंस में भारत में लागू होने वाली टीकाकरण मतलब वैक्सीनेशन की रणनीति पर माननीय प्रधानमंत्री जी, सभी राज्यों के मुख्यमंत्री, राज्यपाल महोदय, सभी का आज की इस महत्वपूर्ण वीडियो कॉन्फ्रेंस में मैं स्वागत करता हूं। आज की वीडियो कॉन्फ्रेंस में भारत में लागू होने वाली टीकाकरण मतलब
Yes, Prime Minister Modi's meeting with the Chief Ministers of States have just begun. Many CMs across states in India are going to be part of this virtual meeting, a discussion with the Prime Minister and of course experts on the panel as well to be discussing the mammoth exercise, the rollout plan of the COVID-19 vaccine on the January 16th. Rahul joining us for more details. Rahul, the first shots coming in of the virtual meet between the Prime Minister and respective Chief Ministers of States. Would we know if every CM is joining in this meeting today?
Nabila, the yet details of which all chief ministers are joining in personally and which all are deputing the health ministers to attend the meeting is yet not known, because some chief ministers had apprehensions. Some chief ministers yesterday, it seems, had conveyed that they may have prior engagements. They would try to be part of the meeting, but they had cited certain prior engagements because of which they may be deputing their health ministers to be part of the meeting. Apart from this, remember, since the Home Ministry is the nodal agency as far as the centre-state relations are concerned, Amit Shah, the Home Minister, is also part of this meeting, and he might be speaking to the Chief Ministers and the Health Ministers who will be attending the meeting, largely talking about how the centre-state will be coordinating as far as this immensely complex and mammoth exercise is concerned. The Health Minister is going to be there. There are certain senior advisors to the Health Ministry who are going to be part of this, and certain members of the core team of the Prime Ministers who are going to be as part of the backup team in this meeting.
Right, we're getting some first shots there, Rahul, of the meeting that's just begun. They're going to be discussing the exercise that will be panning out across the country, across all states and union territories. It's going to be given out, the vaccine dose, the first dose to be given out to high-risk groups on priority. You did mention about the data that's been collated. It has been a huge exercise for the government to actually collate 3 crore frontline and healthcare workers' data, but it seems like they've been largely successful through those dry runs. Many of the hospitals that we've contacted said that they've already submitted their data. Do you feel that the government has lived up to the numbers that they were expecting? Have they got all that 3 crore data as estimated?
Namita, till now there is no large noises as far as the failure of the attempts of the government to get all the frontline workers on board or may be made part of the exercise of the first phase of inoculation. And that is why one can say that the dry runs which happened and the portals which were launched largely to register and the mechanism of getting all the frontline medical and other staff to get registered as far as the first round is concerned seem to have been a rather efficient exercise. But remember, that's just 3 crore odd people. And this is a nation of over 1.3 billion. And that's why it's going to be a massive exercise. And I think this is perhaps the more coordinated element, getting the frontline workers on board. After that, the exercise, when the launch of the Covishield app actually happens, which is yet to be launched, it's being tested, it's being prepared. And that will be the time when the entire mechanism of IT infrastructure and the matrix which has been created may come and face the real test, because that will be individually people registering onto it. There might be a sense of verification, uploading of documents for age verification and others, and a cross verification of the system. And that is why the real exercise will start after the frontline workers have been allocated. And I think this meeting could well be a foundation ground as far as the coordination and preparation of the infrastructure is concerned.
Rahul, thank you very much for joining us with those details. This indeed is going to be a huge exercise, and that's the review that Prime Minister is going through with all the chief ministers. First shots coming in on that.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.